My name is Jim. I chose to have hip replacement surgery because I was finding daily activities were becoming more and more difficult for me. Several times if I was active, I could not even sleep at night, so that it got to the point where activity during the day required me to take pain medication every night just to be able to sleep through the night. I wanted to be able to do more activities like I used to be able to do, so I finally chose to have the hip replacement surgery. Before surgery, I felt my walking was as if I was on stilts. My legs were very stiff. I had no ability to turn my legs to the side. It got to the point where I could hardly step up to a curb lifting my legs, so that steps, climbing ladders, all that was becoming very, very difficult for me. The minimally invasive surgery was a great process to go through, with it being same-day surgery and you're home the same day. That adds a lot to, I think, making a patient feel comfortable. Physical therapy after surgery is critically important to allow your muscles and ligaments to become flexible again, so that you can increase your flexibility and mobility. After surgery, the physical therapist will show you techniques for getting dressed and putting on your shoes. After surgery, walking with a cane, I was pleasantly surprised how easy it was to walk. The motion of using the cane and walking is very easy to learn, and comes very naturally once you start your normal walking movement.
You will start walking immediately after surgery. It may be easier to use a cane at first, but within minutes of getting up and walking, you will be off the cane and walking unassisted if you feel ready. Your physical therapist will assist you until you are comfortable walking independently. They will show you how to use a cane. The cane helps provide a little extra support while you are walking. Your cane goes on the opposite side of your surgical leg. When you walk, your cane and surgical leg work together. As you walk with the physical therapist, you will speed up your walking, and the cane and surgical leg will move at the same time. This will facilitate a normal walking pattern. After surgery, your hip is strong and stable. This allows you to walk without the cane once you feel comfortable. Your physical therapist will help progress you off of the cane. After you walk down the hall, you will go up and down a flight of stairs. To begin, the physical therapist will have you use the cane. Within minutes, you will be doing the stairs on your own if you feel ready. As you face the stairs, place your cane on the opposite side of the railing. Bring the cane up onto the step in front of you. Step up with your non-surgical leg first. Your surgical leg will follow as you step up. Continue this pattern until you reach the top of the stairs. Normally, the cane is on the opposite side of the railing. If you don't have a railing, as demonstrated here, you will place the cane opposite your surgical side. Move the cane forward, placing it on the step below. Step down with the surgical leg. Your non-surgical leg will follow as you step down. Continue this pattern until you reach the bottom of the stairs. As you get more and more comfortable with moving, you will start walking by yourself. You can get rid of the cane as soon as you feel ready. You will get used to the fact that your new hip is strong and stable and doesn't hurt anymore. You will be waiting for the pain to return, but it won't.
After surgery, when leaving the hospital, they will teach you how to get in and out of a car. The movement of getting in and out of a car is difficult because most vehicles do not have the leg room to allow you to move easily without breaking precautions. The handouts do give you some tips that, if you follow them, makes it much easier to slide in and out of the car properly without any problems of twisting.
The following demonstration will teach you the easiest way to get in and out of the car after surgery. To begin, have someone move the seat of the car all the way back. Next, recline the backrest of the seat to allow more space. Back up into the car. Extend your surgical leg out as you sit down, with your bottom first onto the seat. Try to bring your legs into the car together as a unit, staying at a 90-degree angle with your hips. Rotate your body with your legs together as a unit, keeping your hips even with your shoulders. Bring both legs outside the car, staying seated. Extend your surgical leg forward as you push up to stand from the seat of the car. You may place your hands on the seat or the dashboard of the car to support yourself while standing. Place the cane in your hand opposite your surgical leg.
At home, I was able to shower immediately the next day. In my personal arrangement, my shower was one where it just has a small 3-inch lip at the base, so stepping up and over into the shower was not a problem at all. If I did not have that kind of a shower, I'm sure getting in and out of a tub would take a lot more precautions.
When you are at home, it may be easier to have someone with you the first time you get into the shower. The following demonstration shows you how to get in and out safely. Stand facing the front or back end of the shower. It doesn't matter which leg you step in with first. If you don't have grab bars, brace yourself with your hands on the wall. Bend your knee behind you as you step into the tub. Sidestep toward the inside. Stay holding onto the wall as you step in with your other leg. Be careful not to twist too much if you need to turn around once you are in the shower. Make sure you keep your feet in the same direction as your shoulders when you turn. Stand facing the front or back end of the shower. It doesn't matter which leg you step out with first. Brace yourself with your hands on the wall. Sidestep toward the outside of the tub. Bend your knee behind you as you step out. Stay holding onto the wall as you step out of the tub with your other leg. When preparing to get dressed, place a stool or box in front of you. Place your foot on top of the stool or box. You are allowed to bend forward as long as your knee on your surgical side is turned out to the side. It will be easier to put on socks and shoes if your knee is out to the side. The outside of your foot may rest on the box. Always reach between the legs while dressing, because reaching to the outside of your legs can cause twisting, which breaks your hip precautions. Always dress your surgical leg first and then your other leg. You may raise the non-surgical leg up, unlike your surgical leg. To undress, perform the reverse. Remove the non-surgical leg first and your surgical leg last. At the end of the video, we will show you another way of getting dressed if you have difficulty using the modified dressing technique. If you have difficulty with the modified dressing technique, you may use adaptive tools to make dressing easier. Your occupational therapist will provide you with the tools you will need. For Jim, the tools helped him after his right hip replacement. The reacher may be used to help you put on or take off your pants, socks, and shoes. To begin, hold the waistband of the pants in the reacher. Extend the reacher out between your legs to dress the surgical side first. You may lift the non-surgical leg into the pants next without the reacher. To undress, perform the reverse. Lift the non-surgical leg out. Then, using the reacher, push the pant leg off the surgical leg. The sock aid will make putting socks on easier. Pull your sock over the sleeve of the plastic sock aid. Make sure the sock is all the way up to the knots on the side of the sock aid to eliminate any bunching at the toe. Lower the sock aid to the floor with the strings. Put your foot into the holder. Keep your leg extended in front of you while you pull on the strings until the sock is on your foot. To begin, hold the shoe horn between your legs. Place the shoe horn in the shoe. Using the shoe horn, hold the tongue of the shoe up. Bring the shoe horn around the heel of the shoe and lower the foot down into the shoe.
I think the very importance of the exercises allow you to recover and do all the things you want to do with the new hip replacement. So if you ignore the exercises, you're just going to be more limited and have more trouble even though you have a new hip joint. I'm aware that the exercises in my case are greatly improving my mobility and motion, and I would expect that would be for most patients.
After you leave the hospital, your home physical therapist will give you an exercise program. Exercise is important after surgery to help improve your range of motion and strength. Make sure that you start out slow, especially in the first week after surgery. The following exercises will help you get started. Lie on your back, keeping your surgical leg straight. You may bend the non-surgical leg if this is more comfortable, but it is not necessary. With your surgical leg, slowly tighten the muscle on the top of your thigh by pushing the back of your knee into the bed. Hold for 5 seconds and relax. Repeat this motion 10 times. Lie on your back with both legs straight. Slowly move your surgical leg out to the side and return. Make sure you keep your legs straight and your toes pointing toward the ceiling while moving the leg out to the side. Repeat this motion 10 times. With your surgical leg over a roll or pillow, straighten the leg by tightening the muscle on the top of the thigh. Keep the bottom of your knee on the roll or pillow throughout this motion. Once your surgical leg is straight, hold for 5 seconds. Then, slowly lower your leg back down. Repeat this motion 10 times. Sit in a chair. Keep both feet on the floor. Slide the foot of the surgical leg back, bending your knee. You may place a washcloth under the foot of your surgical leg to help slide the foot back. Once your knee is bent, hold for 5 seconds. Then straighten the knee. Repeat this motion 10 times. Stand facing a table to support yourself. Bend the knee of your surgical leg as far as you can. Return to the start position. Repeat this motion 10 times. Stand facing a table to support yourself. Keep your knee straight. Draw the surgical leg behind your body. Return to the start position. Repeat this 10 times. Stand with your knees straight. Move the foot of your surgical leg forward and back slowly. Repeat this 10 times. Stand with your feet flat, keeping your knees straight. Slowly lift your surgical leg out to the side and back. Repeat this 10 times.
I'm definitely happy that I had hip replacement surgery for the additional mobility I already have, and with continued therapy, I'm sure even more activities that I'll be able to do in the future.
No bending at your waist past 90 degrees. No twisting at your hip. No crossing your legs. After 3 weeks, you will no longer have any hip precautions.